As the small casket of 2-year-old Killian Burrow was taken from the funeral home in Dickson, the town was forced to stop and take notice. That's because the turnout was so large that the streets had to be closed.
This is what America needs. We need to pull together and do something like this. Thank you.
Ray Pruitt is a close friend of the family and is part of the Garnet Shield Riding Club, along with Killian's grandfather. Once the word got out that this little boy loved motorcycles, the biking community showed up in force, nearly 2,000 strong, moving Pruitt to tears.
We've got some amazing members. They've been cooking food for the people of Waverly, and the donations have been amazing for the outpouring that we're getting.
And that outpouring came from around the world. Jessica Brizican made a flag with the signatures and messages from bikers in 7 different countries.
People from all over the globe reached out from TikTok and asked for their names to be on it. So I did the flag for Killian, and I hand wrote every single one of their names, their TikTok handles on it.
The sound of the rumble echoed throughout the streets of Dickson. Those in attendance say it was the sound of healing, love, and support.
Because I feel something inside me that I need to be here. To help them to get through this. Like I said, I didn't know the child personally, but in my heart, I feel for them, and I don't know them, but I love them.
And that love is needed right now in this community that has lost so much so fast.
This is not something that our community is going to be over tomorrow. Today is a great show of support, but we have to remember we have to continue to show that support for weeks and months to come, because this is going to be a process for everyone.
A process made a little easier today because of the love from strangers who came together as family.
The latest numbers show Tennessee is first in the country in new cases per capita. The surge being fueled, of course, by the Delta variant. More than 1,100 new cases of that virus strain added in the state last week. Here in Nashville, the number of deaths from the virus now nearing the 1,000 mark, as Metro health leaders say this surge in cases is expected to continue for at least several more weeks. Metro Health is adding some new testing sites and pop-up vaccination clinics, trying to encourage people to do what they can to protect themselves. Metro's COVID-19 Taskforce Chair, Dr. Alice Jahangir, speaking with Fox 17 News earlier today, laying out a timeline for when they think that they could see this spike in cases start to go back down.
You know, my hope is it's a quick drop. But you know, all modeling is just modeling. We can mitigate that risk. Again, if we were to vaccinate and masks, but I think all modeling though right now hopefully shows that by mid-September this can surge out.
Hopefully so. Again, Dr. Jahangir says this wave of cases is not inevitable. Behavior's the driver. More vaccinations, more masks equals less COVID. Right now, only 52% of Nashvillians are fully vaccinated. Now, this surge is hitting mid-state hospitals hard. We've been telling you the beds are full. Some hospitals are now going back to putting all the elective procedures on hold for a bit. Ascension Saint Thomas has postponed all non-urgent elective procedures until further notice. The hospital says it's reallocating staff and resources to create additional spaces to care for severely ill coronavirus patients. Williamson Medical Center in Franklin now encouraging everyone who is unvaccinated to get the shot. Leaders there tell us 80% of their hospitalized patients are unvaccinated. In a statement, the hospital says it strongly encourages the community to do their part to protect themselves, their loved ones, and their neighbors by getting vaccinated, maintaining social distancing, and wearing a face mask in public. Now, while there are many variants of this virus out there, the latest data from the State Health Department shows 1,193 new cases of the Delta variant just in the past week. Shelby County continues to see the most cases of this variant, adding 900 new cases in the last week, now up to more than 1,600 active cases. Both West Tennessee and the Mid-Cumberland regions in our state seeing more than 200 cases each, and here in Nashville, more than 149 new cases of the variant. Joining us now live to talk about the spread of the virus here in Tennessee, Dr. William Schaffner, an infectious disease specialist at Vanderbilt Medical Center. Dr. Schaffner, by now we all know somebody who's had COVID if we haven't had it ourselves. The Delta variant raging, why is it the big bully on the block among all the other strains that we know of?
Well, this Delta variant actually has an easier way to infect people's cells in the back of their throat. It can multiply more rapidly, and thus when we breathe out more of this virus. We shed more. And if that happens, then this virus can spread to people around us. And so the way to get ahead of this virus, obviously, is to prevent that infection. And you can prevent it, as you've been saying, Scott, with vaccination.
And the mask, of course, you were telling me just the other day, they still work. Now, since schools reopened largely without masks in place, we have seen some 30,000 kids across our state get sick. Is this just the Delta variant doing what it does, or are children more vulnerable to it?
We don't think children are more vulnerable, but this Delta variant is seeking out the unvaccinated population, both as adults, and now it's getting down into children. And yes, children are less apt to become seriously infected, but they still can. And the hospital admissions in our children's hospitals across the state are increasing with children with serious COVID infection. And so, children, wear your mask. I wish every child going to school would do that, and do it also when you're in public places.
I want to ask you if you think we should be troubled by these breakthrough cases. Those are particularly concerning to people who say, see, you got the vaccination and you still got sick. What should we be thinking about these people, these breakthroughs?
The vast majority of breakthrough cases, Scott, are mild. They don't require hospitalization. And of course, that's what the vaccine was designed to do, to keep us out of the hospital. Most of the people who are vaccinated and do need admission are immune compromised, or they're quite old and have a series of underlying illnesses. So these vaccines are still working the way they were designed, to keep us out of the hospital.
Let's talk about booster shots. They're now being offered to people with weakened immune systems, some of whom you just referenced. All the arrows point to the rest of us probably getting a booster shot at some point as well. Do you think these boosters will help us against the Delta variant and other variants we don't even know about?
It looks that way. The laboratory studies would indicate that the vaccines we use indeed provide protection against Delta and many other variants. So that's a good thing. We need to hold on to the concept that the variants are bad, the vaccines are good, and they're still working. It looks as though we may need boosters, but those boosters will be coming a little bit later. We don't have formal recommendations yet, but stay tuned.
Amen to that. Dr. William Schaffner, infectious disease specialist at Vanderbilt.